put any questions you're going to have. You are muted on, or at least wise you should be muted. And if you have any questions for Roger or for Andy when he gets on, please put it in the chat box.
Andy's on.
Regarding some quick online meeting etiquette, please mute.
Hello.
Keep yourself muted. Keep your camera on. We like to see your faces. And remember that if you got any questions, please put it in the chat box. And with that, I'm going to turn this over. Here is our district governor, Roger Paschal. Woo!
Hey, all. How are y'all? Good deal. Thank you for being here today. I'm excited that we've got Judge Andy, which is our very own Rotarian judge. I don't know if that sounds right or not, but we do have Judge Andy, so I'm excited about that. So we've got some lots of things happening in the district right now. We're gaining some membership. I'm very excited about that. We've done some club visits. I have personally visited 41 clubs, 27 of those live, 14 of those on Zoom. Got another 9 clubs that I've visited. That's not a official club visit, just where I showed up for an event or handing out Paul Harris Fellows or whatever it may be. So please, if you have not scheduled your club visit yet, please work with Pat Peters and we'll get that scheduled. So thank you very much for being here, everybody. So we're going to talk about a few things before we get Judge Andy on board. But the first one is we're working with Janice Kane is heading up the committee to do a Paul Harris match. If you've not seen that, if you donate $250 minimum, or let's say you donate $500, we're going to match that 1-to-1. We'll match the $250 1-to-1 too. But we really want you to want you to have your club become a Paul Harris Club. These funds are your DDF that comes back to you in 3 years for your matching grants. So hopefully we'll build that up. We've had some extra points sitting out there for a while. We have a limited number of points available, and we are just excited to help build that up. We've already taken the advantage. I think 25 or so people have taken advantage of this, and about 16 or 17 clubs. So please take a look at that. It's on our district website. Our district website is rotary5790.org. Excuse me. And just go send an email, send a message to Janice, and it explains to it on the website what we're doing. But if you have any questions, reach out to Janice Kane, and her email and phone number is on the district website. So please take advantage of that. Please remember, we have the Rotary Jobs and Business Connection on our district website. If you know somebody in your club or somebody in your personal life that is underemployed or unemployed, we really encourage you to have them put their resume on that. This is a joint venture with the Dallas district. So we're excited that if they put a resume on there, it's not only going to go to your local area, but it's also going to go to the Dallas district, which has about 25 or 70 clubs. I think about 20 or so counties over in the east of us. So it really expands and really gets a lot of cool stuff out there. And John, can you think of anything that I'm leaving out, or Pat Peters, is there anything I'm leaving out that we need to talk about before we get Andy on?
Just a reminder to everyone to update your membership if you've had changes, new members or members who are no longer members.
I'm about to teach
Be sure that that's all taken care of by the end of the month. January 1st is dues day. So whatever membership you have in as of January 1st, that's how your invoices will be determined for the second half of the year.
Thank you, Pat. Yes, we split the invoicing up in half this year. So we did half the member dues in July. The other half will be in January. So once again, as Pat said, take care of that.
I wanted to make sure I understood that, Roger, that you want to use the January 1 numbers for the second half.
I love it. I love it. Well, listen, let me call, or what does your tomorrow look like? Can I call you tomorrow? I'm literally about to go.
Hey, John,
live
can you
with-
put Andy on mute?
Yeah, I'm working on it.
Call me tomorrow afternoon. Okay. And then, hey, I hate that I didn't get to see you today.
All right, Chris, you're on.
Well,
Okay. Sorry about that. I just wanted to make sure. You want me to use the January 1 numbers from RI, right? To bill for the second half.
Yes, January 1 numbers from RI. Make sure your numbers are clean.
Yeah, so I'm not going to use the same numbers that we did from July. It's going to be the January numbers. Okay.
Correct.
All right.
I
You got
have, Roger, can I make a comment, please?
Absolutely.
Well, John, I've been helping John Percarney get these web presence surveys in, and most of you all have gotten them in and you've been fabulous, but we still have about 8 or 10 clubs that haven't. So if you all are here, just check and be sure that you've submitted your web presence survey. If not, you can contact me or John and we'll get the link to you, because it's a link. You fill it out, you hit submit, and you're done. So that's all I have.
Good deal.
Mhm.
Good deal. Mark Smith, if you can unmute yourself, we have an announcement that we would like you to push forward in the meeting today.
Yes, thank you, Roger. The Louisville Morning Rotary Club is honored to announce that John and Marilyn Picorni have been recognized as major donors by Rotary International. The Major Donor Award, as everybody may know, recognizes individuals or couples who combined giving has reached $10,000, regardless of the gift designation. So this recognition level can only be achieved through personal contributions and not through recognition points. So John and Marilyn's are going to receive the award and 2 pins to kind of commemorate the award, as well as their names are going to be listed in the major donor report with Rotary International. So please join me in congratulating them.
Very good. Thank you. Thank you, John. Marilyn, congratulations.
thank you.
All
Hey,
right.
if I could, to kind of tag on your PHF comment, Roger,
Please.
for the benefit of anybody on the line that is not a Paul Harris Fellow yet. My first Paul Harris Fellow was in January of 2003. Maryland's was in June of 2005. We did not sit down and write Rotary a $10,000 check. We've been doing this since those 2 years I talked about together. So I encourage you. We started with that 500-point match. Both of us did. Mine in 2003. I wrote a check for $500, which was matched. And 2 years later, Marilyn wrote a check for $500, which is matched. And that's what got us going. So I encourage you, if you haven't thought about it yet, to take advantage of the match that's being offered by the district this year.
Very good. Thank you so much. All right. We'll get this thing kicked off. Judge Andy Eads is our guest speaker tonight. He is the guy in Denton County that all the people get mad at whenever he makes changes, I'm sure. So, and I'm excited that we have his presence tonight. He's going to give us an update, kind of what's going on with COVID. We have lots of people that I know that have had this, and so make sure that you are washing your hands and masking up. You want to wear a mask, so whatever you need to do there, you can just do your mask, right, Andy?
That's right.
All right, Andy, you have the floor, Judge.
Oh, thank you, Governor. Thank you so much. Can you turn this, John? I know you're kind of driving the ship here. Can you turn it on? Can you turn the screen to where I can see? Can I see everybody? How can I switch it around where I can see? I want to see our crew here. What's
Well,
can I
actually, you
see our
control
audience?
that. You have to you hit the screen share up in the upper right hand corner. All
Hang
the
on,
dots.
it's not available for something. I'd like to look and see if I could. Hold on.
So if
Thank
you
you
could
guys
take that,
for being patient with me.
yeah, John, if you could take the screen share off, it would open it
Yeah,
up where
it'll show everybody there.
it'll show everybody there.
There we go.
There we go.
There's all my friends. Hey, Gene Davenport. I haven't seen you in ages. Hi, Peter. Hi, Pat. Good to see you. Larry, how are you? I owe you a phone call, Larry. I have been sick and haven't called you back. So I will, it's good to, it's good to see y'all. I'll tell you, thank you so much for the opportunity to get to visit with y'all tonight. COVID, I didn't know this was going to happen. COVID has been very personal to me and my family. You know, I've had COVID. My wife's had COVID. Our boys have had COVID. I'll get my act together here. All of a sudden, when I saw everybody's faces and all my friends here, it choked me up because I love my Rotary family. So I'll get it together. I just did 2 network interviews. I did one with Telemundo, and I do not speak Spanish. And I said I'll do it, but they'll cover the Spanish. I'll cover the English. But they were precious. I just did an interview with them about our cases and what we're going through, and I'll kind of give y'all some insight into that. And then I just did one Channel 5. So those of you here locally might want to see what we're talking about. But I'll give y'all some of the scoop of what we're doing. But COVID is a interesting topic. You know, as I was listening to the good news about John and Marilyn and them getting their award for their continued donations and support of the foundation, it reminds me of back in January when Ginger and I got to go to the Rotary International headquarters there at the end of January, right when all this was happening. And so I look back on last year and I think about how in 2019, how blessed we were to get to go to, how we got to go to Germany and go to the international convention and see, we got to see Paris at its prime. We got to see London, and then obviously Germany. And so we got to see, and we also, it was a good year for travel. Our son wanted to go to New York City. We owed him a graduation present. We took him to New York City. And so we got to see some of the great world capitals. And then we also got to see the capital of Rotary here in 2020 before everything melted down. And so glad I got to see those cities in their prime. I know they will return, but there's been so much devastation. And so I will quickly explain what a county judge does. The county judge is the highest elected official in the county government. In Denton County, we have about 900,000 people, and we have about 40 elected officials that work in the county government, with the district attorney, your county treasurer, your county clerk, your sheriff, all those familiar positions that y'all as community leaders are so familiar with. But and so the county judges in Texas, the way we're set up, I'm not a judicial judge. Some of y'all smaller counties, you may have, you're a smaller county, and so your county judge has judicial powers, and they do the probate judge, and they're also the judge of your juvenile docket for the juvenile. But in your larger urban counties, the county judge is a CEO. We lose our judicial powers, and we're more administrative. And so one of those administrative powers is that we're over the health department. And so county judges in Texas for now until the legislature meets, and they might have some different ideas about it. But we have the same emergency powers as the governor of Texas in many fashions. And so we can set curfews, we can set different control measures that we had to take in COVID. And so we've had those powers for many years. Most of county government was set up during Reconstruction in the 1880s. So county judges have enjoyed those emergency powers to commandeer property. And if we needed water, if there was a disaster, you could go commandeer water from the warehouse at Walmart and so forth. So those powers are rarely used, but they are available. Most for Texas, those are usually done for natural disasters such as hurricanes and hospitals. I mean, and hurricanes and tornadoes. I got hospitals on the mind, y'all. I've been talking about hospitals all day long, but hurricanes and tornadoes. So those are powers that are granted through the Texas local government code. And so a lot of people have become very familiar with county judges as you've seen them utilize these powers to help combat COVID. And I'll tell you, I've been a big supporter of chambers of commerce, and I'm a Christian, and I'll never forget signing the document to restrict churches there the week of Holy Week because of the mass gatherings we were worried about and closing down businesses. And that's a horrible weight for any individual to have, because you know, when your beauticians are calling you saying, Andy, are you going to close this down? And I said, well, no, you probably have another week or so. So I would tell you that there's so many political leaders that are in Rotary, and I'm proud that Rotarians have a great cross section of professions. I still am a big advocate of, you know, the diversity of vocations. I think that's what makes us strong. But so one thing I would ask that you as community leaders, y'all are all community leaders, is to not necessarily agree with your elected officials, but to support your elected officials. And those are two different things. Those are two different things. You can love them, show their love and support, agree with them when you can agree with them, and let them know that you agree with them when you do agree with them. And if sometimes you have a little bit of difference of opinion, that's okay. But to say, you know what, we appreciate what you're doing, and I know you're doing it the best you can. I would not be in office if it wasn't for my Rotary family and my Rotary friends. And I wouldn't be able to stay in office if it wasn't for my Rotary family. The love and nurture and support that I get from my Rotarians is nourishment to me. And I think the love and support that each of y'all receive from your Rotary Club is nourishment to you, and it's lifeblood. And I just want to start the meeting before we start talking about testing and I want to answer any questions that y'all have, and we can do them in the chat room. We can do them verbally. I'm a big boy. We'll take them however y'all want. Whatever. I want to respect y'all's time, but I will stay as long as y'all need, or we can talk later. But I would just encourage y'all are friends and neighbors. Continue to support your officials in a loving way, not necessarily agreeing, but do provide that love and nourishment to them, because that's something that they need. Coming to my Rotary Club is kind of my safe spot, and I know there's people who don't agree with me, but they love me, and we kind of get through it together. It's okay to hold people accountable, and I think that's one of the things we should do, is hold each other accountable. And Rotary is known for peacemaking, and peacemaking many times starts right there in your club. And so that's just something that I would like to mention as we start this conversation. From a personal standpoint, I've talked a little bit about professionally. I have been dealing with COVID since March, especially in February. I dealt only with COVID for about 8 weeks there straight, with no other topic, no other discussion. It was COVID 24/7. And I think I'm very confident in that as far as our other elected officials, especially the large urbanized areas, 24/7. And so it's been a learning opportunity for all of us. You know, the CDC just changed their guidelines yesterday. And so, you know, as soon as we get the public established and trained and educated on some of the best practices, and then here it goes and it changes. I'll tell you, in Denton County, and I would say for most of the counties, we adopted the philosophy of educating the public. So it's really been about educating the public, not enforcement. Education, not enforcement. We're not trying to arrest somebody. We're not wearing a mask or arrest somebody for having 11 people at their house. Really, the efforts have been focused on educating, and that's been a big part of our thing. I'm glad that we're having this little fireside chat. Roger, I love the way you do that. You have a much better microphone than I do. You look like you're the professional showman that you are. So you have the best microphone, but I hope y'all can hear me. I love the fact that I've joined in on some of these. I think these fireside chats, and the fact that we're talking about this tonight is really great. From a personal standpoint, I was very compliant and very much an example of wearing masks and doing the social distancing. Yes, you can catch this from germs from touching it. And we were really worried about that at the beginning, of sanitizing everything. We really, as the science has evolved, we really realized more and more that this really, we knew from the beginning it was a respiratory, but we're really convinced more and more that that's really how the transmission is taking place. I don't know where all of y'all live. I know where some of y'all live, but if you recall, last weekend we had that cold spell. And I was outside with some people, and as we were talking, you could see that fog that comes out of your mouth if you're late night on a Friday night football game. Y'all know what I'm talking about when you see that. But that's respiratory droplets. That is moisture. That is air from your lungs. That is more respiratory droplets. So when you think about, if you're at a football game on a Friday night and you just look down and see all that fog or whatever that image is, well, that's respiratory droplets, and that's what the mask. So think about how easy that comes out. As kids, you'd pretend you're smoking cigarettes and you'd blow the smoke. Well, that's respiratory droplets. That's how the disease is spread, and that's what we're trying to prevent people from spreading that and wearing that mask. Masks are not 100% foolproof, and I don't think anyone is saying that they are. But will it help matters? Absolutely. So that helps matters greatly. I will remind everyone on this call, like I reminded our club, and I wasn't very popular when I did it, but I said. Public health and improving the health of others is a pillar of what we do as Rotarians. Amen. I mean, do we work to solve medical problems around the world? Absolutely. And that's one of the things I'm most proud of about being a Rotarian. And so I think Rotarians should be leaders and examples of best practices, and not that we all agree with it or feel comfortable with it or want to do it. But I think as Rotarians, we have a special call to be generous of spirit and civic minded and leaders in the community. And so I encourage people to do that. So we can talk specifically about transmission, and one of that is the respiratory droplet. And so the governor does have a mask order. And I don't agree with everything the governor always says or does. I still take his phone calls. I used to not take unknown numbers phone calls, okay, because you think they're probably selling you a warranty on your car. I used to not take those, but he has an unknown, unlisted number, and so he's called me a few times since this whole thing went on, and so now I'm trapped to take every unknown, now I take every unknown caller ID. So I deal with a lot of roofers and everybody else that does the solicitation. But I don't agree with everything the governor's done. I do think he's tried, and I do think he's done better than others. And so I will say that it's not a political statement. That is a medical statement. That I'm making a medical judgment there. It's not a red or blue thing. It's just a fact of the matter. So I think as Rotarians, I think it is critical that we continue to provide value to our members, especially if we are not meeting in person. And so I think I would encourage us as we go through this right now. This is a general broad statement, and I know we have members on here that go to Wichita Falls and down to Brownwood, et cetera, in each one of our hospitals. Most of y'all are going to be in the hospital district that we're in. It's 19 counties in north central Texas. So I'm not going to be precise on some of my language tonight, but I would say that most of y'all are probably in that rack that we call it of hospitals. And so you're going to have a high occupancy rate of COVID-19. In Denton County, we're over 50% of all of our hospital beds in our 5 hospitals are full of COVID patients, and they're staying there. They're coming in later. They're not coming in early because they're toughening it up at home. They're coming in later, and they're staying longer. We do still have fatalities. We lost a lady in her 70s today, a man in his 80s, but we also lost a 50-year-old man from Louisville, Texas. 50's awful young. And so the randomness of the disease is something that worries me. I'm 49, and I caught it, and I did pretty good. I have spent 4 days in a COVID ward. That's the first time I've announced that publicly. But I did spend 4 days in a COVID ward. Nothing like going on vacation and then having a relapse and spend 4 days in a COVID ward. So that is no place to be. And as we talk about being generous of spirit as Rotarians, we need to do what we can so that we can uplift our nurses. So when you're in a COVID ward, you usually have a nurse is usually working 5 or 6 patients at a time. Any of y'all that have been in a hospital, you know the drill. Early in the morning, the phlebotomist comes in and takes your blood for the day. Then it's followed by the little nursing tech who comes in and takes your blood pressure and your temperature, and then they're on their way. And then you have your actual nurse comes in, and then you have another professional come in and clean the room and empty the trash. And then you might have the charge nurse come in and check on you, and then you have your doctor come in. You might have 6 or 7 or 8 different disciplines come into your room during the day. How many of y'all been in a hospital? You know the drill. They come in. When you're in a COVID ward, you're in isolation. You're by yourself, and that one individual nurse does it all. They come in and have to take the blood. They're the one has to do the blood pressure. They're the one, and so because they're not cross-pollinating and letting the different disciplines come into that particular room. These COVID nurses are worn out. They are worn out. I'm so proud of the state of Texas because we exported to New York City in their time of need when they were burying 700 people a day. Hundreds of nurses across Texas answered the call to public service and went to New York City, and they had to do 2 weeks isolation before they got there. They had to stay in a hotel room. They worked there for a month or so, and then they had to do a quarantine afterwards while they were there before they could return home. And so Texas was mighty proud of Texas and what we did to send nurses up there. It's a very different story, y'all, today. And so the hospitals are in a crisis, and it's not because they don't have beds. They don't have staffed beds. And so you can have a whole hallway full of empty beds, but if they're not staffed, if you don't have the staff to do it. So you'll notice the language of your local health department We'll talk about staffed beds. Staffed beds, that's the number we look at. So, you know, when El Paso was melting down a few weeks ago so badly, we were importing and they were care flighting in and bringing in COVID patients from El Paso, Lubbock County. Lubbock is a quarter of the size, Lubbock County, where my sons were at Tech, Lubbock is a quarter of the size of Denton County, has twice the cases and twice the deaths. Lubbock County, because it's a hot spot. So many of those patients were coming to DFW, but that's not the case so much because we're full. So what does that mean for Rotary? That means that we as Rotarians, I would strongly encourage us to go virtual for the next month or so. That would be my personal and professional opinion. If you're not virtual, I want to talk about virtual and how you can do things virtually. I think that's important because we still need to keep our members engaged. And I know membership engagement is something that Roger and a lot of us, and Larry and so much of it talked about, and Gene, we've talked about member engagement for years. But I would really encourage us going virtual for the foreseeable future, for these next few weeks till the end of the year, maybe the middle of January. I would really encourage us to go virtual. Keep it fun, keep it fresh. Check on people who do not know how to do Zoom. Zoom is an easy thing. We had the same number in our club. It's my wife's office number because she was our club administrator forever. And so it's just the office number, and it's just simple. Everybody dials into the same phone number every year. You don't have to get a new email. You don't have to get a new Zoom address, a new Zoom link and everything. Try to make it easy on y'all, okay? Try to get this. I would encourage y'all get the same number to make it easy so y'all can do that. So people don't have to remember. You don't have to send a new link and all that. I would just try to make it administratively easy as best you can. I think that is one thing. And check on people who do not have those capabilities and love on them and encourage them to stay involved. I have worried about Rotary membership. I'm a big membership guy and proponent of membership. I've worried about people dropping off because they feel like there may not be a value in Rotary right now. Still continue to do your programs, still continue to do your happy jar if you have one, or your brag jar. I know a lot of people call those different things. Still continue to do those same rituals and customs, your prayer and pledge, those things that make your Rotary Club what it is. And you still encourage to do those things, because I would encourage us to love one another and be patient with one another, because some people are like, I want to meet in person all the time. Let's try to be respectful of those who have underlying conditions. Not everyone wants to be public about their health condition, and they want to be there, but they can't. And I know that sometimes we're like, come on, come be a part. I know that's tough for some people who may not have it. We all know, we're all grown adults here. Our demographic is older. We're strong and active people and community leaders, but I think that we need to be truly kind and respectful, and that's the culture that we have as Rotarians that I'm so proud of. So from a technical standpoint, I would encourage us to that would be my advice. I'm not a medical doctor, but I do COVID every day for a living and make recommendations. Our club has continued to thrive and do things in new and different ways. And so we've been able to continue to engage our membership. We had a membership outing the other day over the weekend, and I was real scared. I almost encouraged them to pull the plug, but you know what? We had a socially distanced event. A friend of ours, one of our members, has a farm an hour from our club over in Quinlan, Texas, not far from our club. And they invited a husband and wife to come up. They're professional singers, and they drove up from Austin. And we had a socially distanced concert for about 15 of our couples in our club. And the couples sat together. They were 6 feet apart. We had a catered barbecue dinner, and it was over here. It ended up raining. It was going to be in their front porch and out in the lawn. It ended up raining for like a minute, which was kind of the bummer. I wanted a rainstorm if we're going to have a rain, because how you plan, and then it doesn't happen. But we ended up calling the feed store right around the corner. The girls called the feed store and said, will you move the hay out and some of the pallets of feed out? And so it was open doors, it was open air, and everybody was socially distanced. Everybody was 6 feet apart, and we had a Rotary outing. We had a social event. That was very nourishing and encouraging to our members just to get to see each other. We said, no hugging, no kissing, stay with your who you rode in with. And we were able to do that. And so I think those kind of activities, if you're smart about it, I know we are heading into cold weather, but those are the kind of things that we can do to keep our members engaged. And I think member engagement is so important to all of us. It doesn't have to just be virtual, and so that was something that we did just, the Saturday of Thanksgiving weekend, and it was a big success. So that creativity that we have, just put that to good use and keep your Rotary clubs active. So I've got a few slides here. I want to run through the slides, do a little bit of talk about some of the slides, and then I want to save plenty of time for y'all's questions, because that's really what I want to talk about. But I did want to give a little bit of a visit there at the beginning. Okay, so that's my fireside chat. These are our statistics that we pulled together. This was yesterday. This kind of shows that we have 7,000 active. Thank goodness we have, almost 20,000 recovered. We have 158 deaths. Those were our total cases. If you'll skip on, John, to the next slide. This is how our health department and most of the health departments are reporting things. You see our total inpatient occupancy. So we're about 70% occupied right now. Over half of that is our COVID beds. And then you can see, remember we talked about earlier, the COVID patients are staying in longer. They're coming in sicker and they're staying in longer. Earlier in COVID, people were really Johnny on the spot and came in pretty soon, pretty early, but they're actually coming in a little bit later. They're not going in. I encourage you, if you get tested, call your doctor, get on some steroids right away. The steroids are really a secret weapon, and it kind of gets you strong as you fight COVID. And this shows our ICU occupancy. So you can see this was yesterday, and in all of Denton County, we have 5 ICU beds, which is not a lot of capacity. Ventilators were the big issue early on because we were short of ventilators. And when you think of all of Dallas-Fort Worth, and we had less than, when COVID started, we had less than 200 ventilators in all of Dallas-Fort Worth. All of Dallas-Fort Worth. Think of how many hospitals that we have here in Dallas-Fort Worth. We just had a couple hundred that were available. Ventilators are not the problem now anymore. Everybody has plenty of ventilators, so that is, a ventilator is not your worry. John, if you don't mind advancing. This kind of shows the daily report and day by day, and how we do a seven-day rolling average. We get test results from a variety of sources, from doctors' offices. They actually fax them to us. I swear to God, I didn't know there were still fax machines out there. But anyway, they fax them to us. Can you believe it? I'm surprised they don't send pigeons with rolled up test results. But we get faxes from doctors' offices. We get laboratories that send us the results, and then we get the state of Texas provides us. What we do is, when we get all those results in, we dedupe them, so there's no duplication. I think there's a large myth out there that there's double counting of deaths and there's double counting of individuals. And I'll tell you, that does not happen in Denton County. We dedupe those lists. We make sure each one is an individual case. And I'll explain to you quickly how contact tracing happens. So I'm going to use John Picorni, because I love John, and he's got those big headsets on, and I can see him on camera. I'll use John for an example. If John tested positive, we would get those results in about 48 hours. And our contact tracer, this is all voluntary. It's not the big government, big brother. But we would call John and say, John, we got your, if he answers the phone, about 20% of the people do not respond and do not participate with us. Typically, it is older white individuals who do not participate with us. But if we get a response, we would say, John, we're sorry to hear that you got COVID. Can we talk to you about when did you first feel your results? And he might say, you know, I've been sick actually for 8 days now, and I finally broke down, and Maryland made me go get a test. So we would go back to the 8 days. We would say, okay, John, let's go back 8 days and let's talk about where were you the 2 days before? Where were you the 2 days before? Because before you're symptomatic, the 2 days before is where you're the most contagious. That's why we ask everybody to wear a mask, whether you feel good or not, because you are shedding the virus the 2 days, most likely the 2 days before you were sick, you're symptomatic, and the few days after, and the first few days once you become symptomatic and you feel the symptoms. So John would tell us, well, I went to Rotary and I sat at this table with Marilyn and these 2 other people. We would not contact the whole Rotary Club. We would contact the people that John said that he was up close and personal to for over 15 minutes. And so we'd have that great little conversation with him. And we would say, thank you, John, best wishes, and listen and answer any questions he has. Then we would say, talk to Marilyn as well. So we would contact Marilyn and say, Marilyn, you have been exposed. We would contact those 2 people that sat at John's table with Rotary and say, John, we would not out John and say John has COVID. We would say you have been in contact with a known COVID case, and we would ask that you self-quarantine for 14 days, and we would give them advice and love on them and teach them how to do that. That's how contact tracing works. Believe it or not all counties are going this extra step in doing this, but most of the counties have an active and vibrant contact tracing program. By us calling the 2 people that John was exposed to, they know that, oh gosh, I've been exposed, I stay home. By them staying home right there, that prevents them going out and spreading it to other people. Follow me? And so that's how contact tracing, it's not us spying on you. It's us getting a glimpse into we don't track you on your phone. We don't plant a chip in your nose. All these myths that are out there, I can't believe it. I have a whole Facebook. I tell you, I do screenshots of all these Facebook pictures. And I'm going to do one hell of a scrapbook when this is over. But by us contacting the 2 people that John sat with at breakfast at the morning Rotary Club, we help prevent the disease, and that's how we prevent the spread of us. That's how we do contact tracing. And then we go back and we do a tracking, and that's what I'm talking about. That on this chart here is because we would go back. We're not going to count John positive on the day that we got his test results, right? Because remember, he was sick really 8 days before Marilyn talked him into going to the hospital. So we'd go back in 8 days, we go back and fill in 8 days before, because that's when his onset of symptoms was, and that's when he became sick. So the numbers, as we work with our contact tracers, that number, we go back and fill in the date. So let's go ahead and move forward. This just shows our hospital. This is a Metroplex regional hospitalizations. This kind of shows the 15% mark that the governor put in there. He wanted to save hospital capacity. If you recall, everything we talked about and the measures that were taken back in the spring was to encourage everybody to let's prevent COVID so that we have hospital capacity. When all of DFW had less than 200 ventilators, we were not prepared. We did not have PPE, personal protective equipment. We were out. Nurses were using their same mask for 2, 3, 4, 5 days. So we were short. We were asking the public, can everyone buckle down, partner with us, let us ramp up, because we have a national catastrophe going here. China, if you go watch the Frontline episode about China and the masks, how dozens of boatloads of masks that were coming from China that made a U-turn, full of masks and PPE, made a U-turn and went right back to China to cover them and left us high and dry. I watched the whole thing. It had Congressman Burgess on there, our local congressman, talking about it. So it's not fiction, it's fact. And so we really needed the public to participate with us because we were so short of all of our PPE. So hospitalizations was the key criteria in the spring. We geared up. We're in a great position now. And now we're back to hospitalizations again. So John, if you'll advance that, and then I'll be done. I want to answer questions. Again, this goes back to the summer when we had, in the summertime, you see that spike that we had in July, right there around July 4th and so forth. So pleased, the public did a great job on Memorial Day and not congregating any more than necessary and causing a spread. But we are definitely seeing that spike that we had, that we anticipated in the fall, as people just congregate more indoors instead of outside. The outdoor patios are kind of up close and personal. And then, of course, Thanksgiving. Okay, John, we'll move forward. This is a chart. And John has this, and John, you're welcome to share it. This is just the new CDC guidelines they came out with, and we unveiled it yesterday. Remember, we used to ask you, once you were exposed, for you to quarantine for 14 days. John, I'm glad you blew this up. I think you changed that. We used to ask you to stay indoors for 14 days. We realized 14 days is a long time to ask somebody to quarantine. So they've amended that. So you can do it for 10 days. If you do not have symptoms, and you're one of those Wonder Women and Supermen who had no symptoms, and you got exposed, and you're asymptomatic is what we call it, you can get out in 10 days. You can get out of your quarantine. Quarantine is meaning you do not have the disease, but you could be exposed to it. Isolation is once you have the disease, you're staying in isolation after. It's the same thing. You're still staying home. You're still staying away from people, but it's different terminology kind of for the same thing. And so let's advance to the next slide. So this is you can do 7 days of quarantine with no symptoms whatsoever, and you can leave early after 7 days after you test. So remember, we talked about John. John was at his Rotary Club with Marilyn, and he was sick, and he exposed 2 people at his table. Let's just say, we contacted John 8 days later. Let's just say that John wasn't feeling good. Let's say it's a Monday and John wasn't feeling good, and he said, "Wow, I'm not feeling good." And he went to the doctor and got a rapid test and was positive. We found out about that. If we called John and said, "John, who were you with Monday morning? Who were you with at Rotary?" And he told us, and we called them. They do not need to run out and get a test that day. A lot of people run out the minute they think they're exposed. Oh my goodness, at the office, somebody had it. I'm going to go. I saw them today. They've been gone, but I saw them today. I was in a meeting with them today, and I'm going to go get tested. You need to wait 5 days from exposure. That's a magic number for y'all to walk away with from your little tutorial tonight. 5 days is the magic number for you to get tested, because it takes 5 days for it to grow and incubate in your bodies. So you don't want to get tested too soon and get a false negative and then think you're clear. So this is a new CDC guideline. So if you're exposed, you've quarantined with no symptoms whatsoever, you're Superman or woman, and you've had, man, I shook this off. I was around that person, but I don't think I caught it. You can test out of it after getting your test on day 7. So is there any more slides? That just kind of talks about the 14 days and how we need to do social distancing. Let's open it up to questions. And John, I will take vaccines. Let's talk about vaccines. Vaccines are on the way. Project Warp Speed did a great job. We have 3,000 doctors' offices across Texas have already signed up and want to do it. Makes me happy, because this is a very cumbersome vaccine to distribute, because it's got to be, depending on the vaccine, it's got to be in multiple negative degrees. And you got to have two shots. And so health departments like ours are set up, and we have banks of freezers and refrigerators all set up. So super excited. We have 3,000 doctors' offices and healthcare providers signed up across the state. And we have 70 right here in Denton County that are ready to do that. So Let's answer questions. John, I
Andy,
want to make sure we
let me run. Yeah, Andy, let me run through these real quick.
And I'm going to get a glass of tea while y'all are talking, because I've been talking for 30
all right,
minutes. So
good deal.
I'm going to come up for air.
All right. The first question is, you've already had COVID. Are you planning on getting the vaccine, or do you need the vaccine?
From a medical standpoint, that's a great question, whoever asked it. From a medical standpoint, I will follow all the guidelines. I'm the guy that gets the first flu shot every year when we do the flu shot. And so I get the flu shot and get a picture taken, because we encourage people to get the flu. COVID kills 10 times. The death rate on COVID is 10 times what flu is. And so I will take that, Roger, at the appropriate time. I do not want to take one from someone who is at risk. So I'm going to be way down the line. I'll be way down the line. If I did take it, and I would just visit with the health director. If I did take it, I would do it. I would take it. I wouldn't just take a picture. I would do it for ceremonial reasons, because to encourage people that the vaccine is here and it's safe, and we do it. It's still to be determined exactly, if the efficacy of a vaccine, if you've already had it or not, but I do trust the vaccine. I will take the vaccine. I'm not going to take one from someone who needs it. So, but if I did it, if it would help encourage people to take it, I would. And if we had plenty on supply, I would do it to encourage others.
Is it necessary to take it after you've had the virus?
That is to be determined. That is still to be determined. So I'm not going to give a medical answer on that, because the jury's still out on that.
Okay. Next question is Francisca asked if obviously you said Denton County is going to get the vaccines. When do you expect that, and how will they be administered?
Sure, I think sure. It's kind of interesting, because this vaccine is being distributed very differently than like the flu and other vaccines. Many times they go right through the county health department, and we're kind of the distributor of that, and it's working differently. It's going. The state's getting it, and they're allocating it. And the governor even was making some announcements yesterday and today about that. It's going to be going to across the state, not just the metro areas. But like, I know that like Medical City, not franchise, but the sisters and the association of the Medical City, they will get their batch, and they will disseminate that through all of their medical cities. Same with Presby and the other hospital chains. I asked, I'm on all these hospital calls with the hospital CEOs, and I asked early on, I said, why are we doing so good here in the Metroplex with our COVID and with our hospitals and versus New York City? And they said one of the things that New York City has is they're kind of silos, and a lot of their hospitals are standalone, and they're not part of larger systems. And so if you think that we have a Baylor system, we have a Medical City system, we have a Texas Health Presbyterian, we have Methodist systems. So we have not only your Parkland and your John Peter Smith, some of your public hospitals, but we have large systems that they can draw upon. And so they will be working to disseminate those. The priority is going to be your seniors, your most fragile, your seniors that are in long-term care facilities are truly your most vulnerable right now. Your nurses, your doctors, your firefighters, all your first responders, those are going to go first, and then it'll go down from there.
Okay, there's Steve asked if being that we have a shortage of nurses and people that are trained to administer the vaccine, or do we have a shortage of people that are trained to administer the vaccine?
I don't think we have a shortage of people trained to administer the vaccine. I don't, and I would tell you a lot of the syringes are being made right here in Denton County at Little Elm at a manufacturer, and they're making millions of syringes that are going around the world. Believe it or not, some things are still made in America, and so we're very pleased about that. But I don't think the I do not believe the distribution or the administration of the vaccine is going to be a problem. I believe our problem is the long-term care that we're having in the hospitals. So I think we will have that. The tough part, though, candidly, is the whole two-step deal. You know, this is not like a polio shot, or, you know, many of y'all go around the world and you administer a drop for polio. I mean, this is not that. This is record keeping and you know, tracking the days between the vaccinations. So it's got the whole two-step is going to be a little more cumbersome, but I don't see a shortage in that.
Steve also asked, what is the county doing to make sure the citizens, there's a prioritized system for the citizens to get the vaccine?
Okay, they are going to, they're going to work through the county is not going to control everything. There will be a priority, and we will work with our first responders, our hospitals. We work with our police and fire, et cetera. So they will be doing that. The county won't be dictating those terms. And then the doctor's office, the individual doctor's office will be doing that. We will be working with the state, I believe, very closely with our long-term care facilities. Those are licensed by the state of Texas, and we worked closely with them through COVID and through the state-supported living schools, what are called state schools. There are several of those throughout the district, and so we work closely with them to make sure and we actually coached the state on some best practices on how to handle COVID. So that a lot of that's it's very symbiotic. It's very close working relationship. It's not as much, I would tell you, so much of this has not been dictates from on high. It's been very collaborative. So it'll be the same way.
Okay, Chris Castro asked, why was Lubbock County or the Lubbock area so devastated?
And they have great medical facilities out there. They do. They have actually great medical facilities. I would say demographically, this is being recorded, so I got to be genteel in my language. But I think there was a general lack of participation when it comes to some of the measures that we encourage people to take. And so I think in some of your urbanized areas, there is a broader acceptance of mask wearing and other things. I would tell you, I believe Lubbock, Texas's numbers are way underreported. So the difference between, I've got two boys, and Roger, you've met both of them through RILA over the years. You remember Everett and Addison,
Mm-hmm.
you know, and so Everett is a junior, Addison is a freshman. Addison, the freshman, was there 2 weeks, tested positive for COVID. Texas Tech did a great job. I will always love Texas Tech for this. He called us sick as a dog on Friday. We said, go get tested. He got a rapid test. He tested positive that afternoon. Ginger got online. She registered him with Texas Tech. This was about 5 o'clock on a Friday. They called him and said, do not go to your dormitory. We have rented out a whole apartment complex. And he went straight there with his computer and spent 18 days in isolation. Why he wasn't 14 days was because there was a Memorial Day holiday. What was the holiday? The Memorial Day? Labor Day holiday, and nobody was answering the number at the Tech Health Department because they're all on vacation. And I said, you are not leaving till you talk to them. So I run the health department. You got to abide by the rules. He spent 18 days in isolation. Compare that to his big brother. So I think a lot of freshmen were close to mom and dad and abiding by the rules like that. Everett, the older brother, couldn't believe his kid brother went and got tested. He goes, that's a rookie mistake. You know, you don't want to be those college kids don't want to be quarantined for 14 days like he was. And so actually, there's a lot of college kids across Texas who are not testing deliberately because they don't want to be in a 14-day shutdown. They have a social life they want to keep up. That's one of the reasons the CDC changed their guidelines last week, y'all, and which we talked about earlier. They're trying to take that from 14 days to 7 days. Hopefully, we'll get a little bit more compliance, and people will be willing to. They can live with a 7-day shutdown. 14 days is a lot to ask. And so I believe Lubbock's numbers are higher for that. Lubbock has great health care. I think culturally, they did not adopt the practices that were recommended. But I think their numbers are way higher, but their deaths are extraordinarily high, which is really tragic and sad.
Well, another question from Chris is, and this is out there all the time on social media and regular media outlets, is I've heard hospitals have a financial incentive to report COVID cases as opposed to the regular flu or pneumonia or whatever. Is there any truth to that?
There's really not. There's really not. Let me explain how that works. And that was an urban. It's pretty much an urban legend, and it goes back to. And you know what, John, can you take this off the screen and let me see everybody's smiling faces? Because I want to see everybody, and I'm looking at that thing there. That's much better. Good to see. Who's Steve with all the questions? Wave at me. Oh, hello, you. So there was a provision in the CARES Act to help devastated communities so they could get supplemental funding to help. So if you're in New York City and you're melting down and you got to hire these nurses and and the nurses were coming in at $8,000 a day, these crazy numbers when they were coming in to answer the call. That was to help cover the costs of some of those, to help cover the costs of the extraordinary costs of that. But nobody's making money. This was not a profit motive or an incentive. And I'll tell you, in Denton County, there's a lot of myths about people dying with COVID, but not from COVID. Okay, y'all follow me? There's a big difference there. So we had a lady who died she was stage 4 lung cancer. She was in a nursing home, a nursing facility, basically a hospice, and COVID ripped through the nursing home, the facility that she was at. And so we have 3 people that analyze every one of those death reports, and we do a death investigation. So it listed her as lung cancer. She also had COVID. Okay. We go back and we do a death investigation with 3 individuals that independently reviewed that case. And they said, yeah, she had COVID, but she had lung cancer. She had about 2 weeks to live for lung cancer. And so we do not count her, and there's no financial incentive to the county. We do not count her as a COVID death. She died of lung cancer. Okay. And so I think that is a myth that is out there. And that is somewhat of a conspiracy theory, but there's no financial incentives. My wife, Ginger, as many of y'all know her as well. She's the president of the Louisville Hospital Board, and she's sitting right here listening to me. And, she can tell you there's no financial incentive for the hospitals to have a COVID patient. I mean, it's something that's, I would say, as best way to put it, as taken out of context. So that is not a reality.
Okay, very good. Monique asked, how can you sign up to distribute the vaccine, or what can we do to help?
I think what we can do to help, this is what I think we can do to help as Rotarians. We are pro-health. We are pro-vaccination. That is a core principle of what we've been doing for polio forever. And I think this needs to be our new polio drive. There's going to be a lot of people who are skeptical of the vaccination. I think I'm going to have to hog tie my parents who are non-vaccination types. I think we need to be, just as we are pro-vaccination for polio, I think we need to be pro-vaccination for this. We all do social media. If you get the shot, if you get vaccinated, I think you need to take a picture. I think you need to promote and encourage others. Talk to your friends and girlfriends and your people at church and your people at your work, and encourage a culture of vaccination. I don't think we're going to need people, unless you're a nurse or a medical professional, doing that. I think I would love for District 5790 to say, you know what? if you need a ride to get the vaccination, we're here for you. We'll take you and get you vaccinated. I mean, I just think that's a wonderful, creative idea. I think y'all need to be thinking about in your club, start with your club. Who needs to be vaccinated? Let's all go in, just like we want 100% Paul Harris. Let's all do this together and get vaccinated. Let's get our family and friends. I think there's some great creative things. And Peter's sitting there nodding his head. He's a creative guy too. I think there's some great ways that we can promote vaccination. We have said from the very beginning, the big debate that we were going to face was going to be the mask or no mask. And we said from the beginning, those of us in the business, then we said the next thing we're going to have to deal with is the get the shot or the no shot. That's going to be the next battle that we're going to have to deal with. And so, we are not done as far as the cultural battle, in my opinion, on COVID-19. But I think if we just really encourage that within our club, and again, I think we need to respect people. If someone has a moral objection to that or something like that, we need to respect that in the spirit of love and Rotary. I think we need to provide no shame in Rotary, no guilt. I think we need to love one another. But but provide a culture of vaccination. I think that's one of the best things that we could do. And I would love to see a campaign that we do. And I really do. I think we could help get people to the polls, get people to the shot. I think that would be great.
You mentioned earlier we have 3,000 doctors' offices that are signed up for vaccinations. How do we find that list?
That list, I don't know. I'll send that to y'all. I don't have that at my fingertips. Yeah, whoever asks that question, you win the cake prize, the cakewalk. You stump the speaker. I don't have that list, but we can get that. We can get that for you. We can track that down. I'll give it to John, and he can send it out. Okay, and I'll tell you, testing sites, y'all. It's super easy for testing sites. I think that's something each one of your clubs, y'all could find that. The state has a great website, and it's even an app, and it shows where you can get tested, all the free testing sites. Send that out as a part of your culture of health in your club, and send that out, and it'll show in your county, these are the 10 doctors' offices that, Ginger, can you hand me that? Oh, never mind, I can reach it. Let me get a glass of tea here, just a second. I've been sick myself, so I'm on the rebound. But I think you can promote. You can promote that app or that website. Y'all can find it. And John, John Picorni, you're the best guy on computers. If you can't find it, holler at me, and I'll get the health department to send it to you. But it's a great statewide website that shows all the testing locations there, and they'll be cranking that out for the shot too. If you can't find that, John, holler at me, and I'll get that for you from the health department, and because those are statewide resources. But we have 70 on in Denton County and 3,000 across the state. So,
do they need help? Do they need help in distribution as far as the product itself, or anything we can help?
I do not think so. I think this is going to be handled with military precision. It really is. I'm not worried about the supply chain. I mean, we worry about that with Rotary going around the world and getting it to the remote villages and so forth. We are not going to have that. We're not going to have that problem. I'd be very surprised. The interview I was just doing with Channel 5 tonight, they were kind of asking me about that, and we're not going to pardon me, we're not going to have that.
Will the vaccine be paid for by the government, or will the individuals be responsible for paying for the shots?
Great question. The vaccine is free. We will be providing it free. The counties, our county, and I'm sure the other counties as well, will be providing that free of charge. There may be an administrative fee, and I saw one of them that was being quoted here locally was like $18 for the doctor's office to do that. So it's not cost prohibitive. I don't think it's be cost prohibitive. That might be a great project for a club to do if y'all identify a local free location, y'all can promote that to the less fortunate in your community. I think there's a lot of projects here that we can do. And Roger, I commend, and you know, we can do more of these calls. If y'all aren't burned out on me, we can come back together as I see and identify some new needs. I don't have to be the whole program. I can come and talk for a little bit. But Roger, I commend your vocation, helping people with jobs and do that matchmaker, find me a match on the jobs. I want to give a shout out and commend you for that.
Thank you.
I don't know. Did you start that? I can't remember. Did Peter start that or did Roger? I can't keep track of
It was actually brought to us by the Dallas district.
The Dallas.
So,
the Dallas.
John put a lot of hours in that. John McCourtney put a lot of hours.
Okay, John, we're good. Thank you, John.
Yes. Are there any plans, or where are we at on restaurant occupancy? Any plans to decrease or increase that?
Okay, so that just happened, and so I'm speaking to a broad audience here, and I don't know how many people are out of the 19 county area up here. So this may not include Wichita Falls and our friends in, Abilene, but the governor, this was a governor's deal. He did that restriction. And so I was the first county in Texas to opt in to let the bars open up. And my Southern Baptist mother just loved me for that. No, she didn't. She was upset. But anyway, the bars were closed and he allowed bars to open if you met the criteria. And we did not have any scientific evidence at the time that bars were necessarily the big cause of this spread of this, because we had general community spread. Basically, the horse was out of the barn. Okay, so we had general community spread, and so several months ago, when he said you can open up the bars, I opened them up, and for the Denton County, but I had to certify that as soon as we had more than 15% of our occupancy was COVID-19, we would collectively of the group of all the counties here in North Central Texas, if we all met that after 7 days, if we had 7 days continuous over the 15%, then it hit a trigger that the bars and restaurants had to go to 50%. And so the bars, so that is what happened, I guess last Thursday, and I had to certify that where we're at, but it was looking at it as a group. Remember how I talked about the hospitals are working as a group and a system and not a standalone? So the governor divided the state up into hospital regions and said, our region, if this region is getting too hot, not just Dallas County, not just Tarrant County, not just Parker County, but as a whole, because y'all are in it together, if y'all reach that, and we exceeded that. And so some of our smaller counties are actually facing it the worst. Some of the worst, having the worst cases. And so we had additional capacity in the urbanized area. So we're already back down to the 50% right now. So that's where we're at. We've already, and for this part of the state, I'm not speaking for Brownwood. I'm not speaking for Comanche. I'm not speaking for some of those areas. I'm speaking for the North Central Texas area. So some of y'all are rural areas, you may have some capacity.
Okay, Ann Early asked how, you mentioned about Lubbock and about how the numbers you felt they weren't exactly accurate or could be inaccurate. On a scale of 1 to 10, where do you think we are here in the Metroplex as far as the numbers that are reported in the unreported cases?
Yeah, I think we're pretty accurate, and I'll tell you why, because there's multiple data points. That's a great question, whoever asked that. I think there's multiple data points to look at, because we look at the school population and the vacancies in the school and the absences in the schools. I think that tells us one thing. That's one data set. We're looking at our hospital occupancy. We look at the positivity rate. And so that was something that we look at. So if you have 100 people get tested, how many of those are turning up positive? And so that's one of the key indicators that we look at. The reason the reason I pick on Lubbock, and I love Lubbock, Texas, and I love my West Texas people, and like I said, my boys and my money go to Lubbock, but Lubbock, they have a high population, high percentage of their population is college kids, 40,000 students. Kent Hand, former chancellor, is a friend of mine, and he was so proud. I was talking to him a while back, and he said, Andy, I worked for 10 years to get our student population to 41,000, and they just hit it. And so you have 41,000 students there, maybe not testing out of 250 in the city. That's a big chunk of the student population, and a lot of those are on-campus kids, and so that are doing community spread. And so I think that's although we have large universities here in North Texas, I think the percentage of student populations that live on campus that are living under those kind of peer pressure terms of not getting tested, I think that's a smaller percentage of DFW versus Lubbock, Texas, who's isolated out there.
Good deal.
That is strictly anecdotal from the Eads household and and the data that I get from the boys and their friends. Let me explain to you the importance of testing. Everett, my two boys, they have some of their dear friends are these two boys that live down the street from us, and they grew up together. Everett is in a house with the two brothers. Remember the two brothers that live here in Flower Mound? They live out there. They live in a house. Everett is their roommate. Everett is the son of a county judge who talks about COVID all the time and getting tested. The Friday before Thanksgiving, Everett said to the boys, before y'all go home, because they were all about to leave and go home, he said, before y'all go home, my dad recommends y'all get tested before you head back to Flower Mound. They live in our neighborhood. The boys went and got tested. Both of them were healthy as a horse and asymptomatic, and both had COVID. Guess who was at home here in Flower Mound? Their dad, who had just had open heart surgery the week before. Those boys, if my son had not told those boys to take the COVID test, they were asymptomatic, they were healthy, they were fine. They ended up giving it to Everett, who came down with it and was sick for about a week. But the importance of testing, I just can't stress that enough. And they live in Lubbock, and those boys, they didn't want to go get tested, but Everett kind of made them, and they went and got tested. And then what would have happened if Everett had not told them to get tested and they come home and give that to Dad, who just had open heart surgery and had an underlying condition? We don't want to think about that, do we? And that Thanksgiving dinner would not be worth it. That's the kind of intervention that we need to encourage, and we as Rotarians need to have that positive message of encouraging that kind of positive behavior. True story. Okay. That could have happened. That did happen. It could have been a disaster.
Now we're last question we have on the list here. I'm going to skip part of it, but Jessica's asking how prepared, or I'm paraphrasing this, but how prepared do you think we're going to be when COVID, whatever, 21, COVID 23, whatever comes up, Ebola 2.0, how prepared are we going to be for that the next time this comes around?
I think that is a great question. And I would tell you, I think there's two things there's a positive and a negative to COVID. Well, lots of positive and lots of negatives to COVID. I would tell you, I think we are abundantly prepared. President Bush, 43, read a book about the flu of 1918 in the last years of his presidency. And he read it, and it scared the socks off of him. And I've heard him talk about this in interviews, and he's the one who said he realized that how woefully unprepared America was. And so they did basically a strategic reserve of masks. They were actually here and manufactured and stored right here in Fort Worth, Texas, just like you do a strategic oil reserve. And so the federal government at the time, under President Bush's leadership, took great steps and great measures to do that over the years. This is not a political statement at all. I'm just saying over the years, both the Obama and Trump administration made that less of a priority. And so, you know, that I do not believe that that problem is going to happen again. People realize the need of that. That has been one of the great learning opportunities about it. So I think from a governmental standpoint, your county health departments, your state health departments, your federal agencies are going to be much more appreciated. You're listening to a county judge right here talk for an hour about health care that y'all probably would have never sat through before. And I appreciate y'all being here, and I hope it's been entertaining and educational. But y'all wouldn't do that before, okay? But you're willing to do it now because it's important to you. That is the positive of it. What, as a policymaker and as an elected official, what I'm really, really worried about is the COVID fatigue. And so that, and I do believe that our powers that we've been utilizing, and I haven't abused mine, I haven't overstepped mine. I mean, I've been really moderate about things. I do believe that those powers that we have as local officials will be stripped from us in this legislative session. I'm confident that will happen. They will be stripped from the governor. I think those will be stripped from the governor. And there will be some checks and balances that says, well, you might be able to do it, but you have to, you know, seek legislative authority and have a special session and so forth. So I think some of those will be, I think some of those powers will be restricted. You know, I look at the difference between California, who's closing down everything, and I look at Florida. Disney World is open almost back to capacity, you know, and they figured out the right way to do it. And California is still closed, and Orange County has a 20% unemployment rate. So, I mean, I think there's a happy medium there somewhere. But I do think that I think the public is over COVID to a big degree. That's why I think we as Rotarians, we need to shift our focus. And maybe it's away from masks, and people are tired of that, but we encourage the vaccination. I think the public is really fatigued and stressed, and I don't know if we have another disease, if they're going to be as compliant or willing to go along. This was new for all of us. I will tell you this. I am the director of our county museum. We have 7 employees at our county museum downstairs in our courthouse right below my office. And when this whole thing happened, I went downstairs to the ladies and I said, I want y'all to pull up everything you can find about the flu of 1918. And I want all the press clips. I want anything you can pull together. Y'all get it all to me and bring it up to the office. And about a week later, they brought me all the stuff. And the same things that we are doing today is the same things they did in 1918 and did in Texas. They set up an emergency hospital. They set up field hospitals. It was a little bit different back then. The flu would hit a family in the morning, and by the afternoon, 2 or 3 people would be dead in the household. You know, sometimes it killed the kids, sometimes it killed the parents. It usually didn't kill the whole family. It'd kill half or 1 or 2, but they'd be dead that day or the next day. But they closed churches, they closed schools, they closed events. One thing that's different is they would print out the flyers about the latest and greatest closings, and they would have the Boy Scouts get on bicycles and ride all through the city and out on the county roads and disseminate the information. They didn't have Zoom here like John has, like he's running. So they didn't have that, but some of the same things happened then as happen now. What were you saying? Oh, and they did masks. That mask was a real thing. They did masks back then too. So I don't know if they had as much heartburn. There's Roger with his. Roger, that does not qualify.
Oh, it doesn't?
So, no, I guess it doesn't. I'm giving you a hard time.
Smells like milk. All right. Well, that's great. The last part of that question that Jessica had is, how long do you think we're going to be stuck with the mask? Or is there any talk about that? Any guesswork on that?
Yeah, I hate to speculate on that. I think the governor will release that after we get a certain, what the whole thing about herd immunity. And let me give you a 1-minute lesson on the herd immunity. The herd immunity is in a general population of a herd of a group of people. There's enough people. Let's just take your Rotary Club of 50 people. There's enough people in that club that have had the immunization, or they've already had it. They have the antibodies, or they've had a shot that it doesn't transmit as much. So let's just say if John was sick, he and Marilyn were at the table, and those two people had already had the vaccination, it wouldn't spread to them. Okay, so it kind of cuts it off at the pass. And so I anticipate the governor, and I can't read his mind, but I anticipate the governor will release that statewide measure. I think he will do that based on as soon as there's a certain level of the vaccinations. And he might look at the hospitalization rates. Everything that we did in the spring and then now here in the fall really is about the hospitalization rates. I think if our hospitals are full, I think that, I had a friend of mine that was in ICU in Dallas. I won't name the hospital. One of the richest men I know doesn't have one, but 2 jets. And because, you never can have enough airplanes, and he was out in a gurney out in the hallway because the hospital was full. This was back in the summer. All the money in the world wasn't going to help him, and he was out in the hallway. So I think the governor is going to look at that hospitalization rate and look at our occupancy rate. And when that goes down, combined with this increase in vaccination, I think that's what he'll lift that. I've already had COVID. I still wear mine. I still wear my mask as an example. People are mean. They're just mean and nasty. And you take a picture with a mask right here, and by the time you smile out of habit, it goes right to the edge of your nose. They take my picture, crop it, disseminate it, act like I'm not a good mask guy. And I'm like, really, people? I'm trying. So there's a lot of mask haters out there. So on both sides, you're not wearing it enough, or you're wearing it too much. So who knows? But you just do what your conscience guides. Any other questions?
I think that's it. We don't have anything else in the chat. We really appreciate your time. I'd like to get you back here in about 3 months, possibly after this.
And I won't go the whole time. Because I was giving y'all a big crash course lesson we covered a lot of territory, and y'all all got your masters in public health tonight. So I think y'all did. So I hope that answered some questions in some layman terms that y'all might hear and everything. So
yeah, and congratulations on being on Telemundo and Channel 5. I was on a conference with Holger Kanak, which is our president from Germany, and we had all the way down through South America. We had a lot of translators on there, and I messed them all up by saying the word "fixing." I'm fixing to do, and all the translators just went ballistic. They didn't know what to do. So
I'll tell you, I was at the doctor. I'm gonna leave it. I was at the doctor's office last week, and I was getting a blood draw, and a sweet girl was there, and I had my mask on, and she had her mask on. She was real sweet. Her name was Josie, and we were talking, and she was asking about what I do, and she said, "God, your name sounds familiar." And I pulled my mask down. I tell you this for a reason. This is why I do some of this media. This is why I reach out to y'all. And we as leaders need to realize that people watch what we're doing. Y'all are community leaders, or you wouldn't be in Rotary. And I pulled my mask down, and she saw who I was, and she started crying. And this young girl, about 30, she started crying, and she said, "That's who you are." And she said, "You have given me, you have been such a calming force for me. I live in Louisville, and I watch the news, and I have seen all your news conferences." She's in the medical profession, so this is what she kind of follows. And she said, I've been watching this since the springtime and all the stuff that y'all have had to do, the county and the health department and all that. And she just started crying. And she said, you have given me hope, and you have given me peace, and you have given me calm that we're all going to get through this together. And I said, and I grabbed her arm and I said, oh, Josie, you're making me cry now. And this young girl was just sitting there crying to me as she took my blood. And I said, well, honey, I'm glad I could do that. And she said, I followed it, and I saw that you got COVID as well. And I saw that on the news, and I prayed for you that you would be well. And I said, well, I am, and I'm glad to be here today. And so I say that as y'all may not be on TV as much as I am, but you are leaders in your community and having a good positive attitude about this and a can-do spirit that we can get through this together. Rotary has been through things and wars and disasters and depressions and everything. We've always been a shining example. If you look at the testimonies people have about Rotary and how they've been a shining example through devastation. And I think Rotary, this is our new thing. And I'm here as a resource. I'll join y'all anytime y'all want to talk. If y'all want to have off-site thing, I just think I'm excited about, hopefully with this vaccination, that we as Rotarians, we need to be as excited about this vaccine as we are about polio. We're wrapping up polio, y'all. We're wrapping it up. We know we are. We need to be as excited and creative about COVID-19 and this immunization as we are polio. So with that, I'll leave y'all. Thank you. I appreciate it. Gene Davenport, it's so good to see your smiling face. Marilyn, good to see you. Pat, I just haven't seen Peter. We haven't seen each other in a while because we've all been tied up. So Larry, I will call you back. I promise you. I've been sick and under the weather, and anyways, I've had a little bit of complications from COVID. I will tell y'all that. It's not just a cough, not just a cold. It can cause some side effects, and so I'm recovering from some of that. So I'm on the mend, and I appreciate all y'all's prayers, but I wanted to be with you. So hi, Mary Jacoby, you sweet girl. So anyway, talk to y'all later.
Thank you. And everybody have a Merry Christmas. Thank